Let's start with the Chinese medical journal. They looked at 78 COVID-19 patients and found that the 5 with a history of smoking were 14 times more likely to develop pneumonia. That's a really small sample size. The New England Journal of Medicine has a bigger picture. They looked at 1,099 people in China who had the disease, and of the 173 of them who formed severe symptoms, almost 17% of those patients were current smokers. About 5% had previously smoked. It's important to remember that neither study focused specifically on smoking and COVID-19, leading critics to say that we don't have enough information still. But our 9 Health expert Dr. Payal Kohli believes it's about common sense.
Smoking increases your risk of not just contracting the COVID-19 infection, but it also increases your risk of having major life-threatening complications from this infection because it's a respiratory infection.
When it comes to marijuana and vaping, there's not a lot of that going on in China. So again, it's really hard to talk data when it comes to COVID-19. But Dr. Kohli says we already know what any smoking does to your lungs.
Because of the fact that you're a smoker, you have chronic inflammation inside your lungs, and that actually makes the lung cells, work less efficiently to clear particles and viruses that may enter. So your risk of contracting the infection is higher.
And she says the risk that your body will have a hard time fighting it off is higher too. So keeping respiratory symptoms healthy is key right now.
Especially during a time of a pandemic that we don't have a treatment for, that we don't have a preventive therapy for. It's really important to really maximize your chances of doing well if you were to catch this infection.